Hello everyone, it's Thursday morning. It's a nice overcast, semi-overcast day. Here I imagine it's probably getting up to about 31, 32 degrees. I've heard that there's going to be really hot weather down south, but I just checked all the forecasts. And the worst you're going to get is one day in Adelaide it's going to be 38 degrees, but apart from that, looks like Melbourne's in for quite a nice weekend, and Sydney weather ain't that bad. So I don't quite know where all that scuttlebutt comes from, but it is the mainstream media, so who knows how much truth I can add to those stories. I mean, I am cynical about what happens with the mainstream media. Now I've got a couple of stories here today. I got a request from someone who wanted to get an update on what's happening in Sweden, and it isn't good news, unfortunately, but I'll go right into that. And I've got two articles, one from The Hill, which is a pretty mediocre one, which I may or may not put up on screen, and one from Daily Mail, which is a very comprehensive and excellent piece of reporting. So it's nice to see there are some decent reporters still around. I'm very cynical about the level of reporting generally, especially people who seem to access all their information from scuttlebutt through Twitter and what have you. That's real down market journalism in my opinion. But this guy from the Daily Mail seems to have done a very good, thorough job of looking at these issues, so kudos to them. But the first article is quite disturbing for me. It's about having George Floyd included in a Holocaust museum. Now, I just don't get that. I don't see why George Floyd should be involved in anything to do with the Holocaust. The circumstances are totally different. Look, I'll just read the article anyway and see what you make of this, but I think it's just wokeness gone crazy in America, of course, and in Florida. A Holocaust museum in Florida is facing backlash over the opening of a George Floyd exhibit, whose death in police custody earlier this year sparked months of rioting and protests across the United States. A new exhibit at the Holocaust Memorial Resource and Education Center in Maitland features powerful and inspiring photos taken in the wake of George Floyd's death in Orlando 6 reported. The man who photographed the subjects in the exhibit, John Malta, visited the location where Floyd's death took place, taking photos of people reacting to Floyd's death. Lisa Buckham of the Holocaust Memorial Resource and Education Center of Florida said in a statement, "You don't just see this exhibit, you feel it. The expressions and thoughts of each person photographed tells a story that is a very universal message. It is one that can heal and bring us together. It shows us we are not alone in our thinking." What a load of crap. Ezra Levant, founder of Rebel News, wrote, "George Floyd is added to a Holocaust museum that trivializes and distorts the Holocaust and its 6 million Jewish victims, and it grotesquely implies that American police are Nazis." Yes, an interesting subtext that. But I mean, how you can equate George Floyd's circumstances with what happened in the Holocaust is absurd. George Floyd was a free citizen before he decided to get stoned off his head and then get into a confrontation with police, which ended in tragedy. What a surprise. And as opposed to Jews being basically put in cattle cars and sent under a BS story made up by the Nazis to quell any dissension, that they were just being relocated. These people had committed no crimes whatsoever. It's just how you can compare the two is beyond comprehension. The tortures and degradation that the Jews had to put up with, plus gypsies, mentally ill, and a whole lot of other people in Europe at that time. I mean, you can't equate that with the situation of George Floyd, who happened to be born in one of the richest countries in the world, if not the richest country of the world, had the potential to make something of himself, and had no boundaries that he only put on himself. How that can be compared to someone who is a Holocaust victim is beyond me, and it is an utter insult. And it's interesting that some of the left-wing Jews are some of the worst offenders when it comes to being woke. So it is interesting. There's obviously a dichotomy amongst the Jewish community itself here, so it's not that cut and dry. But anyway, I'll get back to the article. Radio host Dan O'Donnell tweeted, a Holocaust Museum added a George Floyd exhibit because we live in a world of idiots where words no longer have meaning. Columnist Carolyn Glick wrote, the Florida Holocaust Museum at a JCL in Orlando has taken a huge step towards transforming the annihilation of European Jewry into a farce. This is a travesty, an insult to the Jewish people throughout history, and I fear it is just a taste of the madness to come. Editorial director for Unlocked UK and former British politician Martin Dornby tweeted, unbelievable, the Holocaust Museum in Maitland, Florida has added a George Floyd section to align Floyd's tragic death with the massacre of 6 million Jews is hugely insensitive, but it's also political. It positions police as Nazis. Awful decision. There's absolutely is a place for this photograph material on Floyd. The images have merit. Its creator is well-intentioned and America is a free country, but not in this location. That's all I'm saying. It's politicizing and positioning is all wrong. Totally agree with that. The United Holocaust Museum released a statement earlier this year on George Floyd's death, writing, as George Floyd is memorialized today in Houston, we mourn with his loved ones and stand with African Americans and all communities who have been grievously harmed by the long-standing racism and injustice that led to his murder and so many others. What a load of crap. From what I can tell, the statistics when it comes to arrests and what have you, the police have been doing a pretty good job overall. There's bad cops everywhere, but they're in the minority, and if they got rid of the police unions, there'd be even less still, and that's what they should do, reform the police force, but not defund police. That's insanity, and this is what these sort of Fruit Loops would probably be supporting. This is unbelievably disgusting. The way these people's minds work is just totally illogical and disrespectful to these genuine victims of just an incredible tragedy that took place during the Second World War. We join the millions of Americans from all walks of life who are outraged and coming together, commit to a better way forward for our nation. We must find new ways of working together to truly fulfill the promise of words engraved on the wall of the museum that all men are created equal. What the hell has that got to do with the Holocaust? George Floyd had a criminal record. He apparently was very bad to his wife. He was physically assaulting his wife, and I think he had kids in his car when he was arrested. Now this guy was high as a kite, and he was driving his kids around the car. This is the model person that we should be putting on a pedestal. Yet they will take down statues of great Americans. The mob, they don't think. They've been brainwashed at university and schools, and the education system is where we really need to tackle this problem, because minds are being polluted. The Nazis did the same thing to kids. They knew they were vulnerable and impressionable, and they created a whole lot of little eager National Socialists. The same's happening with kids being indoctrinated in communism and socialism in America today. It's got to be stopped, and it's got to be stopped now. And that goes for Australia and any other democracy in the world. We need to tackle this problem and stop ignoring it, and have politicians with the balls to make sure that education departments start doing their jobs and throwing out teachers who are indoctrinating kids. Anyway, I'll get on to the next story because I'm on my little soapbox here, and I do feel very strongly about that. Institutions in this day and age need to be bolstered and protected. The mainstream media has basically disavowed itself of the truth and cannot be trusted by anyone anymore. So, we can't live in a society like this long term. Democracy will not survive this sort of attack on our institutions. Anyway, look, getting on to Sweden, and this is the Daily Mail article, which I would recommend. I think is very well written and includes all the information required, which the one from the Hill that comes after it didn't. It is actually very superficial and only mentioned COVID cases. This article mentions COVID deaths, which is a much more important figure in my opinion. Sweden admits it's seeing no sign of herd immunity, slowing the spread of COVID-19 as number of cases soars. As of Tuesday, Sweden had registered 17,265 new corona cases since Friday. Its death rate per capita is several times higher than its Nordic neighbours. Sweden's healthcare watchdog condemned the way elderly have been treated. The IVO noted that some elderly people were left to die without a medical exam. Well, if that's true, it is shameful. And this article was penned by Chris Dewars for Mail Online. So well done, Chris. Kudos where kudos is deserved. I think you've done a great journalistic job with this article, so hats off to you, mate. Sweden has admitted it is seeing no signs of herd immunity slowing the spread of COVID-19 as the number of new infections soars. The Nordic country, whose approach to tackling the pandemic has garnered global attention, registered 17,265 new cases since Friday, according to its health agency on Tuesday. The increase compares with 15,085 new cases recorded during the corresponding period last week, with hospital admissions for corona patients almost doubling each week in Sweden. Now, at least he's mentioned the proper stats, the deaths, the hospitalisations, and of course the corona cases. But that's not so important, because the corona cases could be a product of just better screening. So that's why that shouldn't be a headline figure, really. It's the deaths and the hospitalisations we should be looking at. Anders Tegnell, architect of Sweden's lockdown-free strategy, had previously claimed that Sweden would fare better than other countries in the second wave after building up a herd immunity. Sweden registered 94 new deaths, that's the important figure, taking the total to 6,500. Sweden's death rate per capita is several times higher than that of its Nordic neighbours, but lower than some larger European countries. Now, I also want to emphasise here that Sweden has taken in a lot more migrants than most countries per capita. And that's another factor. It's the elephant in the room in Sweden, and they're not allowed to really mention because they'll be labelled racist if you question their immigration policy. But it's got to be mentioned here. I'll mention it because I think it is a relevance. I don't have the exact figures on that, but I suspect that Sweden has probably taken in a higher percentage of migrants, and that is where we had a lot of cases in Sweden that were cropping up in areas where there were migrant enclaves, mainly because of cultural differences, communication, and a number of other factors. But do we need to look at the overall picture to get a good response? A lot of journalists don't do that, and I'll say the journalist in this article at least has covered most of the bases, although they haven't mentioned this particular issue, which I think is relevant. The news came as Sweden's healthcare watchdog issued a stinging condemnation of the way elderly people in the country have been treated in care homes during the coronavirus pandemic, noting that some patients were left to die without a medical exam. Sounds like they got a consultancy from Andrew Cuomo, from the governor of New York. He seems to be good at killing off elderly people, and then he writes a book saying how wonderful he is. I mean, the guy's got no qualms about pushing his own barrow in spite of the fact that he's an utter failure when it comes to coronavirus. But anyway, the health and social care, as I said, the serious flaws could only be blamed on the pandemic, concluding they existed even when the added stress of the virus outbreak was taken into account. Yeah, that's pretty poor. Nursing homes were ravaged by the initial wave of coronavirus, prompting Prime Minister Stefan Löfven's sombre admission in May that the country failed to protect its elderly. Yeah, that's not the only one. Of the 6,500 deaths linked to the COVID-19 in Sweden, nearly half have occurred at elderly care homes, and a quarter have been elderly people being cared for at home. Yeah, that's pretty damning, actually. In an audit of care facilities during the period from March to June, IVO noted that a fifth of all coronavirus patients in care homes had not been individually assessed by a doctor, and that 40% of those cases the patient was not examined by a nurse either. I would tend to think that our healthcare system in Australia is a bit more rigorous than this. I think that doesn't reflect well upon Sweden, who is regarded as one of the great social welfare states, and it seems a real hole in that social welfare net, which I'm sure the Swedish-born population is getting quite elderly, I would think, and it's going to become more and more of an issue. So you've got to look after your elderly, and you've got to that's what should have been done. Should have targeted the elderly for special attention, but it appears as if there's a lot of holes in their system. In those cases where an assessment was made, the majority were made over the phone, and fewer than 10% of patients received a physical examination. The minimum level of care is simply too low, even during a pandemic, IVO Director Sophia Wallström told a press conference. In its investigation, IVO has identified serious shortcomings at regional level when it comes to the care provided to people living in nursing homes. This is without question very serious, Loven said in a statement to Reuters. All people have the right to individually adapted care regardless of where you live or how old you are. It's important all regions take this seriously and make the necessary changes. I expect this to already be underway. The agency concluded that elderly residents at care facilities had not received adequate care in either confirmed or suspected cases of coronavirus. OVI also said its story of elderly care had been hampered by inadequate patient records. Sweden's high number of deaths in elderly care has been hotly debated in the country, which has long prided itself on its cradle-to-grave welfare system. Less than 1 in 10 COVID-19 patients are examined face-to-face by a doctor, with the vast majority of assessments consisting of consultation between nurses and doctors alone, sometimes with primary information stemming only from orderlies. The probe did not single out individual facilities or staff. While failings were admitted as systemic, IVO's decisions for the individual regions showed some had operated under instructions to avoid hospitalisation nursing home patients. One region prescribed end-of-life treatment for any resident with COVID-19 symptoms. After a lull during the summer, cases have shot up again at elderly care facilities during a second wave of the pandemic, raising fears of a repeat of the deadly spring. Nursing home residents account for nearly half of Sweden's more than 6,400 deaths among the COVID-19 patients. The watchdog urged regional authorities to carry out measures to improve care and prevent them no later than January 15 next year, and said it would be carrying out further review of patient records. The country almost famously never locked down to the same extent other European countries did. While polls have shown widespread support for the strategy, it also has been controversial, especially as the death toll soared above those in neighbouring countries. Well, I want to make a point here. Remember, we are looking simplistically at this again, because Sweden did allow business to continue on as per normal. There's probably a lot less suicides that took place in other countries where they had strict lockdowns. We've got to see the whole picture to get a fair indication here. This is all based on the medical aspect of the equation without the social consequences being taken into account to get a true overall figure. So on the raw figures, it looks as though Sweden's not doing that well. But if you take into account the effects of harsh lockdowns in other countries to get a true comparison, I think you'll find that the figures aren't quite as widely spread as they may seem. That's what we need to do, and journalists these days generally don't want to tackle these hard questions. They want to do a superficial article that's going to get the most hits, and that's how journalism operates these days. So you've got to really look out for a decent article, because there's not that many around, as you'll find out if you. I'll flash up the Hills article at the end of this, because I usually rave on so long that I run out of material to put on screen anyway. So yeah, well, I'll do that, and you can make up your own judgment on that. One of Sweden's tougher measures was a nationalised ban on visits to nursing homes. It imposed on April the 1st, April Fool's Day. The measure was lifted on October the 1st, but last week the government paved the way for local restrictions. A country of 10.3 million people, Sweden has recorded a total of 225,560 cases of COVID and 6,500 deaths. We have done substantially better here in Australia. We've got 25 million people, and I don't even think we've cracked 1,000 deaths yet. So, mind you, we are a warmer country. So, again, and we have a lot of migrants, but I don't think we've got quite the concentration of those enclaves that you may have in Sweden. So you've got to compare apples with apples. Last week, Sweden's top epidemiologist, Dr. Anders Tegnell, was forced to admit that Sweden is fighting a second wave of the virus after previously downplaying the risk. Stricter restrictions were issued on the 17th of 21 of Sweden's regions by country's public health body, and Dr. Tegnell, as well as a 10 p.m. curfew on bars and pubs. Well, you can't afford to drink much over in Sweden anyway because of the taxes, so it's probably saving people money. Anyway, I think a lot of people in Sweden will be drinking at home, probably doing what my Norwegian friend who lives in Sweden, he goes down with his Volvo and loads up the truck with loads up the back with beer he's bought in Denmark, which presumably has got slightly better, more relaxed taxation laws on alcohol. It's a different situation than we had in spring when it was more local. Now we have a community spread in many regions in the same time, which is partially a reason why we see such high numbers, he said. Despite the rising numbers and increasing criticism, Tegnell said in November 13, Sweden remains steadfast in its approach to the pandemic. In August, Tegnell attributed low infection rates to the development of a herd immunity against the virus developed during the first wave of the spring, when Sweden's light touch approach was blamed for one of the world's highest per capita death rates. The number of people we don't find with diagnosis is with high probability smaller than we thought, he concluded last week. While Sweden's death rate per capita is lower than in countries such as Spain and Britain, it is more than 10 times higher than neighbouring Norway and almost 5 times higher than Denmark. They've got a lower death rate than in Spain, which actually has more benign weather, which is interesting, but they are used to more social contact. They're a very touchy-feely country, and I guess that counts against them. But both of Spain and the UK have had harsh lockdowns, and they're still doing worse than Sweden, who has avoided lockdowns. And so I think Sweden's still doing okay. They may not be the top of the table, but it doesn't invalidate their strategy, in my opinion. So I think we need to take all these varying details into account. I'm actually just finished watching an excellent documentary, a Channel 5 UK documentary called The Great Plague, and this was about the Black Death that hit England in the 1600s, the 17th century England, and at one stage wiped out a quarter of the population of London as estimated. So it's about 400,000 people in London, around 100,000 perished, and then it spread to the regions in the south. It didn't actually go so far up into places like Manchester, which was interesting, but it did actually go into the surrounding areas around London and hit mainly the south. But it was then again, it was the opposite to COVID in that they think it was transmitted by body lice and fleas, not rats, and it flourished in warm, humid weather, which is more prevalent in the south of England. So that did make sense. Fascinating documentary. I'd recommend it if you can see it. Channel 5, The Great Plague, well worth watching, and puts things in perspective compared to COVID, which is affecting a way smaller number percentage-wise, death-wise, than the Black Plague that ravaged Europe and the world in those period of time around the 16th century, the 17th century and the 1600s. Anyway, that's enough of my yakking. No doubt I've gone way over time, as I usually do. Please give me a thumbs up or thumbs down on this video. Please comment. I really enjoy. I've had some good comments, and as I say, I was going to do a Swedish update, but the person prompted me yesterday, so I went ahead with it. So I'm trying to to fulfill any demands that are there. And I know I do have a few Swedish supporters there. I hope I haven't lost too many of them. And finally, please subscribe. No one seems to be wanting to subscribe to my channel on YouTube anymore. It seems to be dropping off. And even the same with Bitchute, not getting any additional subscribers. So please consider subscribing to the channel. I would really appreciate that. Maybe I'm just not going to grow as a channel any longer, but I'm hoping I'm providing quality content and that is entertaining. That's really what I'm trying to do, and maybe I'm failing. So, oh well, you can only do your best, and I've got plenty of time on my hands, so it keeps me occupied. So I guess it's a bit of a win-win. Anyway, look, have a great day. It looks like we're in for a really good weekend, especially down in Melbourne. Enjoy the weather, enjoy your freedom, even though it may not be unbridled freedom. At least you don't have to wear masks outdoors, and that's a big bonus. Still much more relaxed up here, and I'm very grateful for the fact that I am living in far north Queensland. So look after yourselves and enjoy the rest of the week, and hope the weekend's as good weather-wise as it looks. Catch you soon.